That's a very difficult question in many ways because there were so many factors that played into it. But I think first it would be fair to say that it had to do with both my childhood, my adolescence, and my adulthood. Childhood, I had sleeping sickness when I was a child. And for several months, I was unconscious. Then when I gained consciousness, I found out I had to learn to walk all over and to talk again and to move my arms and so on because all of my musculature had disappeared. And I learned then, during that year and the subsequent recovery period, what it's like to be somebody that has a long-term chronic illness. That was one factor. Another was my time overseas in the service. I was flyer in World War II, and I noticed that people in my squadron, some of them, would get feeling so upset and anxious that they became what I would call psychotic. They would start hallucinating. They would get some delusional ideas about who in their squadron was really trying to help them or who's trying to hurt them or whatever. And talking with them about this problem that they had made me realize that there was quite a bit of difference between those people and those who did not get those kinds of feelings. So again, I talked to our I guess you'd say Surgeon General about it, and he told me that these people were actually becoming psychotic, and then gave me a book to read on what is psychosis and that sort of thing. So those two things influenced me when I came back to eventually in undergraduate school enter the School of Psychology. And after I got my undergraduate degree, then I went on to graduate work in the field of clinical psychology, which had just become a division of psychology at that point. And I worked 4 years of my time, as well as going to graduate school. I worked 4 years in a mental hospital. And during that 4 years, I began to understand more and more and more about the problem of mental illness. And what caused me the greatest worry is they didn't seem to have any place to go to. Very often the relatives would say, well, you know, we really don't have a job for him in our neighborhood because he can't or won't do anything. And so I started looking at our return rates, and they were, for people who'd been hospitalized over 6 months, they were going up to 75% within the 6 months. And in looking into that and studying it and talking with the relatives and the patients, I began to understand that they really didn't have any role in the community. They didn't have any place to go. And so that's when I started building up the idea of how could we create something for them in the community. And having a background in social psychology, I began to think of groupness. Could we place them out in a place where they could support themselves as a group? And this then started to be the basic question that we were asking in subsequent researches in the hospital that led up to the First Lodge Society.